Just a second, we're just getting everything set up. All right, do you have your paper, pen to take notes? All right, I think people are joining in. There we go. All right, I'm just going to mute everyone. So if you have a question, you can always raise your hand and I'll unmute you. All right. All right, let's get started. Welcome, everybody. Welcome, welcome. Thank you for being here. So today we are going to be covering, or over the next few sessions, we are going to be covering how to prepare for cancer treatment. My goal here is to demystify it for you. More so that you feel comfortable, relaxed going into your treatment, and also you know where you can look and find information. Because I know that when we are going through treatment or when we are just diagnosed, there is so much information coming our way. So my goal is to make it more clear for you. So let me walk you through presentations. And then after every presentation, we're going to do some hands-on work while we're going through those presentations, because this is all immersive. This is all for you to prepare and get ready for your treatment. Okay. So with that, I am going to get started and share with you my screen. Okay, can all of you see my screen? Yes. All right. Okay. So let's start with this first. I want you to think about what's the superpower you have. I would say for me, my superpower is being able to ask why. Why are we doing things a certain way? Is there a way to do it better? Being able to visualize a better future in situations that are important to me. I think that would be my superpower. And then thinking about how to get there. So think for yourself, what's your superpower? Type it up in the chat. Let's hear what you're thinking. If you're joining online, then you can type it up in the chat and share with us what your superpower is. Empathy, I love that. Very nice. That is definitely a superpower. Extremely resourceful. Yes, that is really good. We need that. Going through this journey, I think we're going to be needing empathy. We're going to be needing resourcefulness. We're going to need, resilience. So great. Very nice. Very nice. I know there are many more coming in. Also want to share with you that we are going to have a giveaway. So for people who are who use the hashtag, I will navigate cancer confidently, share it on Facebook with your friends and community. The person who is using the most, we're going to give 1 month of our signature group program which is Navigating Cancer Confidently program. So as you're going through it, um, do share it with the community. All right, share what you're learning, because you will learn more as you're writing, as you're taking notes, as you're sharing it with people that you know. All right, so what are we going to cover? So day one, today, we are going to cover overview. We are going to cover mindset, because that is going to be a very important piece for us as we are going through this journey. We are going to go into the overview of cancer, and then we are going to go deep dive into chemo. So we're going to go into chemo, infusion types, chemo treatment types, and side effects, and oncology emergencies. All right. And then tomorrow we are going to go into the other treatments. We're going to go into immunotherapy, hormone therapy. We are going to discuss radiation, and then how do you handle radiation side effects and treatments. We're going to go over surgery, and surgery related side effects and treatments. And if we have time, we're going to touch caregiver. So day two is deep dive clinical. So we're going to get all the knowledge. And then day three is we're going to be preparing for the best outcomes. So now that we know all of this, how do we use this information for our preparation? How do we use this information so we can better understand and we can plan in advance? We can be prepared for what's coming our way. So we're going to go into a lot more of the planning exercises. We're going to discuss caregivers. We're going to discuss communication. How do you handle difficult communication? We're going to discuss how do you prepare for your treatment? How do you select your center? How do you select your doctor? Or what questions you can ask them? How do you stay on track with your medications and self-care? So we're going to cover as many of these as possible, depending on the topics that are of most interest to you. All right, so let's get started. So I want to tell you first about our journey and why I even started to do this. And that's because as a cancer nurse, what I was seeing day in and day out was that when I was taking care of patients, they were relieved. They were happy that they had guidance and support. At the same time, most of us are spending our time at home, which is great. Most of 99% of our time is spent at home, and during that time, there is just so much of fear about something bad is going to happen, or bad things are happening, so there is that turmoil that's constantly going on. And because of that, there is such a significant impact on health and outcomes. And at the same time, I was seeing in my clinical practice, in my private practice, that we were able to have much better outcomes. People felt much more relaxed. They felt much more grounded and prepared for what was coming. So I started to think about, how do I start to provide this guidance and support to the community? And that's where this journey started. I started doing research in this area, which was NIH funded, and then in developing these extensive protocols in guiding for managing different aspects of care and symptoms and quality of life. And then that research had groundbreaking outcomes. It was first of its kind in a way, in using multimodal approach and being able to show that it significantly does improve symptoms and outcomes and many other factors. So I wanted to think about, okay, now that the research is there, how do we bring it to the community, right? Because my goal in all of this is to bring it to you. So how do I bring all of this knowledge and expertise to you? How can I help you to have better outcomes? And all through this process, my personal journey, so that's kind of where, the organization started, and we've been offering these services and programs to the community. Until now, we were offering it in corporate settings. So we're working with large health plans and large organizations and offering through those. But a lot of times we would get a lot of questions and requests about, I need help and I need help right now. And when COVID happened, then these challenges became even more significant. Um, so a lot of people would reach out and say, I heard you are offering this, and there is, I really need to know what to do. I have a lot of questions. Can I get some guidance? And at the same time, these courses that I used to teach when I was at Cancer Center, at Stanford, UCSF, Mayo Clinic, I was teaching a lot of these prepare for chemo, prepare for surgery, a lot of these courses to empower my patients, empower my community to have better outcomes. Many of those courses stopped. So that's where I decided, okay, I'm going to start helping individuals around me. It started by helping friends and family. And then as more people came in, I realized, well, I think this is something that, while it used to be part of our group program, NCC program, we launched it to the community, which people were finding very helpful. I realized that this is something that's such a core need of being able to know, how do you prepare for treatment? How do you feel relaxed, when such a big event has happened in your life? So that's where I decided that this prepare for cancer treatments, we're going to offer it to the community at no cost. So it's our gift to you. I hope that you'll find this process and all the education here helpful. So let me touch on why. We are spending time here together. You have many other things that you could be doing. So why do you need to think more about it? And that's where I want to empower you on why it's important, what are the challenges, and then we'll go into how do we address it. Can you still see my screen? Okay, so the reason why we need to think about this is because we know that when we are going through cancer treatment, whether we're going through chemotherapy or radiation or surgery, it is associated with significant side effects. So anything from 6 to 12 side effects on average is, what most people are experiencing. So we know that that's part and parcel of what we are going through. At the same time, when we are going through these treatments, um, we are also experiencing anxiety and depression. One is because, of course, it is traumatic, going through, having been diagnosed with cancer and going through this, but also the treatments itself impact new cell generation, um, and that results in feeling fatigue. It results in feeling depressed. It results in feeling low. So we know that it is associated with us feeling that. So what ends up happening with this is that on average, most people, many of us, when we are going through cancer, and I saw this up close with a lot of my family, um, uh, and um and the challenge is that on average, every person who's going through it, we tend to have a couple of unmanaged symptoms and complications. That's part and parcel of it. So the baseline is about 2 to 3 such events per person while going through treatment. Um, and because of that, then, we are having all those challenges and struggles and, ED visits and things like that. It can be expensive. It can impact our plans for what we had, how we were thinking this whole process could go. But the silver line from all of this is that as I started to see these challenges, I also started to realize, and something of hope for you is that, in fact, it is possible to prevent these complications. It is possible to prevent some of these complications. So that's where our signature method, our trademark method of doing a whole health approach to care, where we are anticipating physical and emotional needs, social needs, and support needs, and then combining that with a care team to guide and support, um, can provide the right guidance and support throughout the process, so that you can have better journey, so that you can be much more relaxed and prepared while going through the treatment and navigate the treatment, and have better outcomes. So this is what I was doing in my research. And then even after um, getting started with the company, with this organization, we continued to see those outcomes and even better outcomes, where we saw higher touch points, more engagement. So that means you're feeling more connected, improvement in knowing when to take medications, what to do, being ready for the appointment, because if our lab values are off or something's not okay, it would be difficult. But if we are prepared, then we are able to go for our appointment. Being able to involve our family member, being able to have better symptoms. This was, I would say, something that I'm most proud of, is that um, the community that worked with us, they saw 30 to 80% improvement in symptoms compared to baseline, and they felt a much higher quality of life. So they were able to go back to the life that they wanted. And the impact of all of this was that financially it helped individuals to have a lot more savings, or prevent many of the complications that could have occurred and the cost associated with it. And many people were able to return to work several days in advance. So we work with many organizations, and we are a 501(c)(3). And now we recently started to work with various nonprofit communities and starting to offer programs and services to the community. So that's why we are here. A lot of testimonials, but in the interest of time, I will um, move on to the next thing. I hope you can go and check out the testimonials, or hear stories from other patients on our website. Right. So with that, I want to jump into the next one. Um, so now we talked about a lot of these treatments and the challenges and the possible fear, right? So I want you to take a moment and pause and think about, what is it that you are afraid of? What is it that you're worried about? Um, Take out your piece of paper and pen, and um, let's write down our fear. Okay, so this next one that we're going to, okay, so do you want to share what are your biggest concerns or fears, if any? Okay. So this journey can sometimes be overwhelming. And that's why the first thing I want us to tackle is, how do we prepare our mind? Because that's where we will draw our grounding from, and that's where we are going to draw our power from. That's where we'll need to learn to honor when we we have days where we have low energy, where taking a shower is a big win that day, and the other days where we have energy and we need to motivate ourselves to go for a walk. um, and it'll all come from the way we think about things, about the way we train our mind. So that's why I think the most important training I can share with you is how to train your mind. In my own journey, having gone through some very difficult health challenges, having been a victim of very violent domestic violence, I've had to go through a lot of challenges, and through all the physical and emotional ups and downs, what I learned was that it's the mindset that will make a difference. So that's where I want to take you next, in priming your mind. Okay, so let's get into this. Uh, yeah, so very nice. Go deep dive into fear so it does not stop. Yes, exactly. Go deep into it. Yes, leverage the strength, um, that use the energy of the fear. Okay, so now let's get into mindset. So here, what we're going to touch on is developing your guiding life principles, setting your personal goals, mastering your mindset and habits. Um, so when we are going through this journey, um, there is so much that's coming at us so fast, right? So we suddenly need to become so knowledgeable and become expert in this thing called cancer, and we need to become expert in the different treatments that we are getting. So we will be learning a lot of things. um, so it's important to know that, yes, focus on progress, not perfection, because there will be things you'll learn, you're going to try it. Not everything is going to work. So, especially if you're looking at self care and different ways, you're going to have things that work for you and some don't. So, continue to evaluate those, and find your path forward. And remember, never give up. Keep working on yourself, whatever that is for that day. And each day we strive to be the best version of ourselves. So, like I said, focus on perfection, focus on, sorry, focus on progress, not perfection. Um, some days the progress is we got up and we went for a walk. Other days progress is, we smiled um, when we didn't have the energy to, because we wanted to give that love to our family. Um, so I want you to take a moment and write down, what is the best version of yourself look like? As in, right now, as you're going through this process, what do you envision that journey to be? So take a few seconds, give you a minute to think about this. And then you can share it in the chat here with us. Yes, being happy and calm. Very nice. Very nice. I think for me, it's waking up, feeling feeling rested and energized, and ready to take in whatever the day brings. Yeah, very nice. Feeling energized. Very nice. Feeling empowered. Oh, this is so beautiful. Using my thoughts as cues to my unmet need. Oh, that's so powerful. Very nice. Instead of swirling with thoughts of fear and doubt. Yes, you got it. You got it exactly. Listening to those thoughts, those feelings. What is it trying to tell us? What is the unmet need? And using that in a positive way. Very nice. um, Continually improving myself. So empowering, so positive. That's fantastic. Great. Very nice. Very nice. So, our formula for success, because we know we're going to be learning a lot and we're going to have a lot of unexpected things along this journey, is that we're going to continue to learn. We're going to do what we can. And as we go through this, we are going to make corrections. Very nice. I think we got another one. I want to be the grandma I have been in the past. I'm afraid it's going to get me sick that I won't be able to enjoy. Um, well, we take one day at a time and we be the person that we can be. We be the grandma that we can be because people love you unconditionally. Um, so that's why I think remembering this every day and coming back to priming our mind is going to be one of the keys to being prepared and to having the best outcomes for us, right? So getting our mind and body in the right state, grounding ourselves so that we can have the best outcomes, trusting that we are going to get there, and being in that place of mindfulness. um, that's what we can do to continue to be in this process. So feeding the right thing to the body, feeding the right thing to the mind, so that we can be in that place. We can be in that place of grounding, we can be in that place of love. Mastering the mind, recognizing when we are feeling um, closed in because of fear, because of anxiety, because of our self doubt, and taking the action, even if that action means, we're gonna do walk around the house, one lap around the house, doing little actions towards the goal that we want to accomplish. Right. So I want you to take a moment and think about your why. Why do you want to get through this journey? What is the goal that you want to accomplish? I think many of you have already identified that, been talking about it, on what is your why. So take a minute, think about your why. If you haven't shared it already, then you can share your why is it important to you to have the best outcomes? Why is it important to you, um, to be prepared? um, so think about that. Share it here. Okay, let's continue. And very important to form strong habits. So if you want to, whatever that one habit is that's important to you, sometimes what I see is that we suddenly are trying to do everything. We were not exercising, we were not cooking, and then suddenly we're like, okay, I'm going to go work out every day while I'm going through my chemo, and I'm going to make fresh food every day, and I'm going to get groceries, and I'm going to juice and all of that. Well, that's a lot, right? So kaizen, one bite at a time, one small thing at a time. So think of that one habit that is going to make the most difference for you. Pick that one thing, and then try to make that a part of your daily life. Try to build a community around it so that you can look forward um, to that. Okay, so what is your community around it? If it's workouts, then have a group of friends that you're going for a walk with, or that you're working out with, so you can look forward to it. So whatever that is for you, think about that. Write down what comes in the way of that, what habits come in the way for that. So for me, sometimes it's I want to go for a walk in the evening, or I want to meditate in the evening, and sometimes uh, I'm tired at the end of the day and I just turn on TV. And once I turn on TV, then I just don't know where the time goes. So what I try to train myself is that I first do my meditation, and then only after I've had dinner, after I've done my meditation, then I will watch TV for some time. And the only time I watch TV is with my partner, so we can enjoy the show together. And it also limits the time. So think about that for yourself. What your good habits are, what your other habits are. Okay, and then you go from pain island to pleasure island. So identifying what are your challenges, and identifying where do you want to get to, and then how do you get there. Okay, in the interest of time, I'm going to move things along, so that we can get into the core topics. Okay, this working on mindset is really, really important, because other things, you'll gain the knowledge, you will gain the expertise, you'll find the answers. The mindset is something that we'll need to work on every day. Okay. So now next, I want to go into giving you an overview of oncology. Okay, so I'm going to cover that quickly because I want to spend most of the time with you on identifying your treatment and working through your treatment. Okay, so let me pull up that presentation. Okay, so a lot of this is the basics of cancer. So I'm gonna just touch on it. I'm assuming you know a lot of this already. If not, then take your time and you can watch this at a slower pace. Okay. So of course we know oncology is the study of cancer. Now, cancer isn't just one cancer; it's actually a group of hundreds of diseases. With the main component that there is a genetic change in the cell. So wherever there is a change in the cell in the body, that's essentially the beginning of cancer. Because what happens is that the cell starts to grow uncontrollably, and that can form a tumor. Now, it's not only tumors, because we also have cancers of the blood and of the lymph, which are the other forms of cancer. So what are the different excuse me, what are the different kinds of cancer? So let's touch on that. So carcinoma, it's the one where it begins in the skin or it begins in the tissues of the internal organs. So that's where breast cancer, prostate cancer, lung, colorectal, etc. So the ones that begin in the organs, those are carcinoma. Okay, the ones that are sarcoma is muscle or connective tissue. So sarcomas would be cancers of those of the muscles, of the fat, of the nerves, tendons, those kind of things go under sarcoma. And then leukemia is the ones that are cancers of the blood, and lymphoma is cancer of the lymph system. So if you're having, whatever the name of your cancer is, hopefully now you know how that name is derived. Okay. Um, Now, you might have heard the word metastatic. Is my cancer spread? Is it metastatic? Metastatic means that the cancer cells have been growing and they've been developing new tumors. So, metastasis means that the cell is traveling to another part of the body. That's metastatic. Now, there are many different ways that cancer is diagnosed, each on its based on the kind of cancer that is suspected. There are different tests that are done. Biopsy is the most common. And then there are several screening tests that we do regularly to identify if there is a risk of cancer, because colon cancer, breast cancer, prostate cancer, those are some of the most common cancers, skin cancers. That's why these screening tests are part of our preventative tests and services in most health plans and part of recommendations. Okay, I won't go too detail into the different screening tests. You can search and read up on that online for your particular cancer if that's of interest to you. Now, something you might have heard is the stage of cancer, right? So you might have heard or seen in the report that they have written what is the staging, TNM, right? So let's demystify that. It's actually quite straightforward. So T stands for tumor. So what is the size and location of your primary tumor? N stands for the node. So has the tumor spread to the lymph node? So lymph node is, it's circulating. It's like little clusters, and through that there is a risk of circulating the cancer to other parts of the body. So that's where N stands for the node, whether the tumor has spread to the lymph nodes, and M stands for metastatic, which we learned is, has the cancer spread to different parts of the body. So that's TNM staging model. Okay. The other way that staging is typically done is to say whether you're stage 0, 1, 2, 3, or 4. So here, 0 means that it's local in that particular area. It's very, very small. Stage 1 means it's just started, it's early stage, it's local in that particular area. For example, if it's breast cancer, it's just on the, let's say it's in the left breast. Okay. Stage 2 and stage 3 means that it has started to occupy bigger area, or it has spread to, let's say, from left breast, it's also spread to the right breast, or it's spread to that chest cavity area. Stage 4 would mean that the cancer has spread to other parts of the body. So let's say it's gone from my breast tissue to my lungs, or it's gone to stomach or to some other part of the body. So that would be metastatic. That's stage 4. So it's spread to other parts of the body. Okay. All right, so hopefully this gives you a sense of understanding what your cancer staging means. Based on this type of stage and the cancer and many other factors, we have several protocols that help us to determine what kind of treatments we can offer. So that's where your oncology team would be working on determining what's the best way to tackle this cancer. What kind of treatment we're going to give. Is it going to be multiple treatments? Typically it can be surgery and chemotherapy, or surgery and radiation, or chemotherapy and radiation, or hormone therapy. So that's where the treatment plan gets determined based on the cancer, on the stage, and based on many other factors. We will touch on some of these main ones as we go through this. So we're going to be touching on chemotherapy, radiation, surgery, hormone targeted immunotherapy. Palliative care also is something we're going to touch on. All right. Active surveillance means that we are going to wait and watch that how this cancer is progressing, and based on that, determining whether we need to treat it. So, of course, knowing about this is important for your health, and to know why you're being given certain treatment and why this treatment could be effective for it. You can always go online and search on credible websites about your treatment and about your cancer. Okay, so now let's go to the any questions so far on the overview? I know I've touched on kind of the basics and the overview of cancer and the diagnosis and the way it is staged. Any question on that so far? Okay, so let's move on. So next, I want to go now deep dive into chemotherapy. Okay, so we will start to go deeper into it, understand it from the basics to all the way to your treatment. All right, so chemotherapy is a treatment that is given to stop or slow down the progress of tumors. Okay, so it's usually an infusion, or there are different ways that it is given, but it is systematically given into your body so that it will target the cells, the cancer cells, and it will help with preventing the growth of the fast growing cells, because as we saw earlier, cancer cells are fast growing cells. They are having uncontrolled division. Okay, now because of that, because chemotherapy is targeting fast growing cells and new cells that are being formed, it's also affecting the healthy cells in our body, which is why we start to feel tired. So we have constantly our red blood cell, white blood cells being formed. We have new cells being formed on related to taste. So that's why we feel fatigue, we feel weakness. That's why we have taste change. That's why we tend to have hair loss, because even our healthy cells are being are part of